Looking at more physically demanding jobs, manual labor type jobs, getting back into work there, I want to assess their physical capacity. Same thing with returning a student back to gym class. I want to make sure that they're safe to do physical exertion. So I'm going to bring them in. I'm going to do a Buffalo concussion treadmill test on them to assess what their physical capacity is. This assesses blood flow to the brain. It assesses the levels of your autonomic nervous system, and it assesses your ability to exercise and tolerate exercise. If the person is able to do this and achieve an exertion level that they would need to do that job or to be in gym class or to do that type of physical activity, and they don't have any increase in their symptoms, then I'll let them go back to work. All right. If they're a construction worker that drives heavy machinery or big trucks, that's a whole other topic to begin with. That's similar to returning somebody back to driving, which is a nuanced thing in of itself. And I'm just going to say on this, as I'm talking about it right now, there's really no evidence-based protocols on this. This is using other people's protocols that have been established and kind of telling you guys what works best in my world for me and my patients. So take that for what it is. This is very anecdotal, as they say.